Mr. Speaker.
Order. Questions for oral answer. Mr. Patrick Day.
Question 1.
Can take the first two questions together.
Sir, employers of foreign domestic workers, or FDWs, buy medical insurance for their FDWs directly with insurers. Insurers are not required to provide individual claims data to the Ministry of Manpower. MOM regularly tracks hospital bills from public hospitals to ensure that our employers have adequate coverage for their FDWs. Based on the records of public hospitals, the current compulsory minimum coverage of $15,000 was sufficient to meet 97% of all inpatient and day surgery bills for FDWs in the last 3 years. For the minority of employers who face genuine difficulties in paying their FDW's medical bills, they can seek help through the medical social workers at the relevant healthcare institutions. Medical social workers will assess each case individually and provide assistance based on their needs. MOM regularly consults relevant stakeholders such as insurers, employers, and employment agencies, and reviews the minimum insurance coverage to ensure adequate protections at affordable premiums for our FDW employers. We are mindful that mandating higher insurance coverage will raise premium costs for all the employers. Notwithstanding, our current policy already allows employers who are concerned about the risk of higher medical bills to have the options of taking up insurance with higher coverage. Thank you.
Mr. Patrick Day.
Thanks, MOS, for the reply. I just want to have asked two supplementary questions. Firstly, will MOM be reviewing the insurance coverage as 3% of employers, which is actually about 6,000 to 7,000 people, still face huge medical bills beyond the current coverage of $15,000? And there's little or no help for those FDWs who get inflicted with critical illness, chronic condition, mental conditions, and other conditions requiring long-term or critical intensive care. And sometimes the bills balloon to the hundreds of thousands. And second question is, how will MOM ensure that FDWs employed by employers are free of major medical conditions, such as mental illnesses, including depression, and those physically undetectable at point of hiring?
Sir, I thank the member for the two very important supplementary questions. First, about the medical insurance coverage for the 3% of the FDW employers. I would like to clarify that it is not 6,000 to 7,000 employers of the FDWs who have or who are facing difficulties in paying very huge bills. Because in the last 3 years, according to our statistics, there are 1,900 such cases. I mean, not such cases, not 1,900 cases of FDWs who have chalked up, bills. But then of this 1,900, about 770 actually have incurred more than $15,000 of medical bills. So on the average, it's about 55 cases a year. Right, for these cases, they can actually seek the medical social workers for assistance in defraying part of the medical costs if they genuinely have difficulties in meeting the medical bills payments. And whether we will consider reviewing, sorry, what's your second question?
Free from medical conditions.
Okay, all right, thank you. Thank you. For all the first-time FTWs coming to Singapore, they are required to undergo a full medical examinations at our healthcare institutions in Singapore. So it is a time where our doctors in Singapore will examine all these FTWs to pick up any symptoms of mental illnesses. Actually, mental illnesses are not covered, but some major illnesses, such as heart conditions and all that, so as to reduce the risk of FTW employers employing FTWs who may have potential major illnesses. Thank you.
Dr. Tan Wu Ming.
Thank you. I thank MOS for his answer. I've met Clementi residents who are elderly and who therefore are not in a position to shoulder the cost of healthcare for their domestic helper if the domestic helper has a serious illness exceeding the insurance cover. I've received feedback that some FTW agencies do not provide enough information about insurance plans with enhanced cover at the point of hiring. Would the ministry consider encouraging FTW agents to provide better information to prospective employers? And secondly, what avenues are there to expedite claims for FTW insurance in the event that the insurer is taking a long time to process the claim?
Well, let me answer the second question first. For FTW employers who have difficulty in claiming the insurance coverage for the medical bills incurred by the FTWs, and if the delay is excessive, and the employers or FTWs can always approach Ministry of Manpower for assistance. As for your first questions of employer agencies providing adequate information to FTW employers on medical coverage, we have been working closely with employment agencies to highlight to them the need to explain the various medical insurance coverage for the FTWs where the employers can make decisions. So given the feedback by the member, we will continue to engage our employment agencies to require them to be more proactively to disseminate the information to FTW employers, particularly the first-time employers who may not be familiar with the medical insurance. And on the other hand, MOM also disseminates, provides information through our newsletters called Inform to FTW employers to also provide information on medical insurance coverage. And also on the MOM website, such information is made available. So for those who are more internet savvy, they can actually seek out all this information from the MOM website. And in particular for your residents, the elderly residents who has this medical insurance issues for the FTWs, if you wish, you can let me have information so that MOM will look into it. Thank you.
Mr. Lim Biao Chuan.
Thank you, Speaker. May I ask the Minister of State, I too have a resident staying in a private estate, not poor by any means, stuck with the same situation where his domestic help incurred a bill of more than 50,000 for critical illness. He can afford to pay, it's just very difficult for me to explain to him that he has to pay that large sum of money for a domestic helper who is really not related to him. In situations like this, what does MOM advise?
I thank the member for very useful questions. Well, as it is now, although the mandatory compulsory medical insurance for FTW is capped at 15,000, but employers actually are at liberty to buy a insurance that has got higher coverage. So we will continue to encourage our employment agencies to disseminate this information to employers that for the peace of mind, if they're worried about the risk of higher medical costs in future, they actually have the options of buying a higher insurance. But for those who are genuinely having difficulties to pay the high medical fees incurred by the FTWs, they are encouraged to seek the assistance from the medical social workers in the hospitals. And from our statistics, actually very few employers are genuinely facing financial difficulties. Like, for example, the case that you mentioned, I think on the average, there are about 3 to 4 cases of FTW employers having to face the medical claims of between 30 and above $50,000. So the number is very small. And in the case of a resident, he has got a financial means to pay so that he doesn't need the assistance from the hospitals. But for those who genuinely have difficulties, they are always encouraged to approach the MSW for assistance.